Hey everyone, welcome back. Today is a massive milestone. We are officially on part 11 of our 100-part CPC exam series. We're going to be breaking down the genitourinary system, basically uncovering exactly how anatomy and medical terminology drive your coding accuracy. Now, before we jump into this highly requested explainer, make sure to like, share, and subscribe to Decode Healthcare with Harshal. It really helps us keep creating these focused explainers just for you. All right, let's get into it. Okay, let's dive into this. Here's a quick look at our agenda for today. We'll be going over GU coding drivers, urinary anatomy and kidney functions, reproductive system structures, UTI coding by location, pathologies and key procedures, and wrap up with a summary and a peek at part 12.
Section 1. GU coding drivers. And this brilliantly illustrates the exact variables you need to be scanning for in any operative note, literally before you even peek at those CPC exam answers. For the GU system, your coding decisions are heavily driven by organ specificity, laterality, right, left, or bilateral, and whether we're talking about the upper versus the lower tract. You also absolutely have to identify any infection or obstruction status. These little nuances, they can completely change your code selection, so keep a sharp eye out for them.
Moving on to Section 2, urinary anatomy and kidney functions.
The kidneys are absolute powerhouses, right? They don't just filter waste, they're doing some incredible heavy lifting. They're meticulously regulating your body's fluid, electrolyte, and acid-base balances. And surprisingly, they actually control your blood pressure via renin. On top of the whole shebang, they produce erythropoietin, which stimulates red blood cell creation. So, when you're reading a chart and you see these complex physiological processes mentioned, boom, that points you directly toward your renal codes. Now, to really memorize this for the exam, let's walk spatially, top to bottom, right through the urinary tract. The pathway starts way up high in the kidneys, which house the cortex and the medulla. From there, the urine travels down the ureters. Those are the tubes connecting right to the bladder. The bladder is basically acting as a holding tank. And finally, everything exits the body through the urethra. You've got to lock in this one-way, top-to-bottom flow. It's absolutely crucial because your codes will often progress based on exactly how far a scope travels up this anatomical pathway. Section 3. Reproductive system structures. Establishing clear geographical anchors is kind of the name of the game here. For male structures, the documentation is frequently going to reference the testes, the epididymis, the vas deferens, prostate, and penis. For female structures, you're on the lookout for the ovaries, fallopian tubes, uterus, cervix, and vagina. So, whenever you see a procedure, immediately link it back to one of these specific anatomical anchors. It's going to lead you straight to the correct code family. Next up, Section 4, UTI coding by location. Now, what's really interesting about this slide is how it highlights a major exam trap. Look at how the anatomical root word instantly changes the clinical severity and, by extension, your CPC code. If the chart says cystitis, you're dealing with the root cysto, so that's a lower tract infection of the bladder. But if it says pyelonephritis, well, nephro means kidney. That makes it an upper tract infection, which carries a much higher clinical severity. And then urethritis is just localized to the lower tract urethra. Spotting that root word, it literally solves the trap instantly. Section 5. Pathologies and key procedures. Okay, we see these disease processes tested all the time. Nephrolithiasis, that literally translates to kidney stones. Then there's BPH, or benign prostatic hyperplasia, which involves an enlarged prostate causing lower urinary tract symptoms. We also have female-specific conditions like endometriosis and PID, which is pelvic inflammatory disease, right alongside male-specific conditions like erectile dysfunction. And here is exactly how we treat those pathologies. Notice the medical terminology at play here, guys. That suffix, ectomy, it always means surgical removal. So a nephrectomy removes the kidney, a hysterectomy removes the uterus, an oophorectomy removes the ovaries, and a prostectomy removes the prostate. For something like chronic kidney failure, well, that's where dialysis steps in to replace those heavy lifting kidney functions we were talking about earlier. Finally, Section 6, Summary and Part 12. Seriously, take a screenshot of this right now. Think of this as your one-page visual summary cheat sheet. So the crucial point is seeing how all these pieces interlock. Nephro/O links straight to kidney stones and nephrectomies. Cysto connects bladder infections to cystoscopies. Hystero ties the uterus to hysterectomies. And prostato links BPH right to prostatectomies. Basically, by locking down the root word, you unlock the diagnosis and the procedure all in one go.
And just like that, you absolutely crushed the genitourinary system today. Coming up next in part 12, we're going to be diving deep into endocrine and nervous system anatomy. We'll cover the major glands, the central versus peripheral nervous system, and some absolutely crucial neurological procedures. But hey, before you jump to the next explainer in our series, I want to leave you with a little something to think about based on what we covered today. How exactly do systemic hormones secreted by tiny, distant glands dictate the heavy lifting and blood pressure regulation performed by the very kidneys we just studied? Think about that for a bit, and I'll see you in part 12.